So hello, everyone. Thanks so much for joining us today for the kickoff of our three-part webinar series on building multi-sector partnerships to advance housing policy. Today, you will hear from leaders in climate, health, and education sectors on building cross-sector partnerships to advance housing policy. Each of the speakers today are part of the Opportunity Starts at Home campaign, which is a multi-sector campaign for affordable homes. And I'll be the moderator today. I'm Chantel Wilkinson, the campaign manager of Opportunity Starts at Home. And before we begin, I'll let us hear a bit from one of our founders, Nan Roman. She is the president and CEO of the National Alliance to End Homelessness.
Hey, Chantel, thank you so much. And thanks for inviting me to participate, and welcome to everybody to this very important webinar. I'm going to take just a few minutes to describe how we've gotten where we are in terms of the lack of affordable housing in the country and the impacts of the affordability crisis, and also how Opportunity Starts at Home, OSA, emerged to address that crisis. As you know, housing affordability is a combination of the costs of housing and what people earn, or a mismatch between those two things. Often in the modern era, throughout the 50s, 60s, and 70s, we had more than enough units of housing that were affordable to all poor and low-income households. Even the lowest income people could generally find some type of housing that they could afford. That might include single room occupancy housing, boarding houses, apartments, and so on. Of course, that housing wasn't always the safest housing or the healthiest housing, but it was affordable. And of course, also there was a tremendous amount of racial segregation at the time, and good housing in good neighborhoods was certainly not available to everyone, but generally people could find housing. Starting in the 60s and the 70s, 1960s and 70s, there was urban renewal, and a lot of housing stock and indeed whole neighborhoods were lost. A lot of the supply of affordable housing was lost. There was also conversion of multifamily rental apartments to condominiums. I mean, prior to the 80s, you really couldn't, except in a few places, you couldn't own an apartment. Apartments were always rental. Now, of course, that's quite different. That eliminated a lot of the rental stock. And by the early 80s, there was a serious shortage of affordable housing, many fewer units than there were poor and low-income households that needed those. This is Nan back again. We don't know what happened there, but hopefully you can hear us, and I'll just resume where I was. I was just going to say, I think that one manifestation of this loss of affordable housing units was the emergence of homelessness in the early 1980s, which we had not had prior to that, widespread homelessness since the Depression. The loss of affordable units and the rising cost of housing and the failure of incomes to keep up has, of course, continued and indeed increased until today. And now the country is over 7 million units short of enough affordable housing for the households who need it. The minimum wage is $7.25 an hour, but a person would need $24 an hour to afford a modest 2-bedroom home. Over 70% of extremely low income households are paying well over half of their incomes for housing, which affects their ability to support their children, buy food, access health care, and generally to thrive. It's not a good situation, of course. And these problems disproportionately affect BIPOC populations who are the subject of widespread discrimination. For example, 20% of Black households and 15% of Hispanic households are extremely low-income renters versus only 6% of white households. As housing affordability challenges have grown, it's become increasingly clear that the lack of safe, stable, and affordable housing also has significant negative impacts on other social and economic factors. People in poor quality, unstable, and unaffordable housing have much worse health outcomes. Children in unstable and unhealthy housing do less well in school, and their families often have to move from school to school. People living in poor housing in disadvantaged neighborhoods cannot access healthy food or affordable food. Across the board, unstable, unaffordable housing impacts the ability of other social and economic sectors to meet their goals that they want to achieve in order for people to thrive. In 2016, the National Alliance to End Homelessness, my organization, the organization I'm with, the National Low Income Housing Coalition, the Center on Budget and Policy Priorities, and Children's Health Watch entered into discussions with the Melville Charitable Trust about building a coalition of organizations representing these other sectors to strengthen the advocacy for housing that's affordable, safe, and safe. Together, we formed Opportunity Starts at Home to lift the visibility of the unmet need for affordable, equitable housing, and to build political will by mobilizing far beyond just the housing field, which I have to note was not doing such a great job of getting housing onto the agenda by 2016. We created a steering committee and a roundtable with nearly 100 members from the faith, child welfare, food, health, incarceration, climate, behavioral health, education, race equity, gender equity, and many other fields. We also have 15 state partners that bring multi-sector coalitions together at the state level for federal advocacy. Our agenda at OSA is threefold: rental subsidies for all who need them, flexible short-term funding for those who can basically afford their housing but are on the edge and for whom any economic crisis could result in them losing their homes, and capital to increase the supply of housing that's affordable. So that is a brief overview of the affordable housing crisis and what OSA is proposing to do about it. We very much appreciate having our speakers here with us today and those of you attending. And I'm now going to turn it back over to Chantel Wilkinson, campaign manager, Opportunity Starts at Home campaign. She's going to moderate the panel discussion.
Yes, thank you, Nan. And I thank you for the remarks, and I echo the things that you said. And yeah, we're building this movement of all these diverse voices, and we have a couple of them today. So let's jump into the panel. Today, you'll hear from Makita Harris. She is the senior policy advisor sorry about that. She is the senior policy analyst with the National Education Association. You'll also be hearing from Khalil Shahid. He is the senior policy advisor with the Natural Resources Defense Council. And you'll also hear from Jenna Juritz O'Brien, who is a pediatrician, and she's going to be speaking on behalf of the American Academy of Pediatrics. So let's get into the first question that I have for the speakers today, which is that all your organizations it's a range of different topics that you cover, a range of different priorities that you cover with your organizations. So if you can all speak to the mission of the organization and also explain why the organization is concerned with the lack of stable, affordable housing.
I can start since I'm not on mute. Again, Makita Harris, Senior Policy Analyst with National Education Association. NEA is comprised of roughly 3 million members. We are the largest teacher union in the country, one of the largest unions in the country. Our membership is comprised of educators on all levels, including not only teachers, but we have support staff, ESPs, education support staff, paraprofessionals. We also have aspiring educators that are members, those that are still in school, aspiring to become teachers or educators. We also have retired members and members that are in higher ed. So that makes up roughly 3 million members in the country. So in terms of NEA's interest with regards to housing, we are well aware and very conscious of the connections between education and housing. It's been well documented that housing and educational outcomes are intersected, and housing has an impact on education for many families, many students, and actually for our teachers as well. Educators are not immune to housing instability. We have our education support paraprofessionals. Many are renters. Early career educators, those that are just starting out as teachers, are predominantly renters. So educators are not immune to the housing crisis or housing issues in this country. And I think COVID has pretty much made the home an epicenter in terms of education. So our interest as an organization around housing and the impact that it has on our members as educators as well as students is growing. And it's also aligned with the racial and social justice work and the priorities that we have as an organization.
I'll go next. Good afternoon, everyone. Khalil Shahid with the Natural Resources Defense Council, based here in our DC office. NRDC is an international nonprofit environmental organization of scientists, lawyers, environmental and community health specialists. We work on all areas of the environment, including air and water quality, but also pollution and of course climate change. And because of that, our work, there's really no aspect of our lives that our work doesn't touch. Housing obviously being a key piece of that. Our residential sector causes or is responsible for about 14 roughly to 20% of our nation's carbon emissions. It is a huge bulk of where we spend our time, where we consume energy, but there are also other environmental issues related to housing and the location of housing. Rising sea levels that are threatening many of our coastal cities. Are placing millions and actually billions of dollars worth of affordable housing properties at permanent risk, and the families who live there. Increased incidents of extreme weather are placing many families in harm's way due to hurricanes, due to flooding, and other disasters such as what we saw happen in Texas earlier this year with the cold freeze, which also impacted communities and cities such as Jackson, Mississippi. And so all of these things. So the relationship between housing and the environment is one that is very key for us, but also important. Housing, is just critical to the stability of communities and the workers who we are going to be relying upon, to build this new sustainable future. And meeting those challenges are not going to be done through environmental policy. It's not going to be done through energy policy, but it's going to be done through housing policy. And so as an environmental organization, we've learned that we need to engage, genuinely and very forthrightly in advocacy around affordable housing, for the workers, for the families, for the communities that we need to be our heroes and sheroes to lead this transition forward, to save us from the worst effects of climate change. And so over the years, working with our partners in energy efficiency, and now through Opportunity Starts at Home, we've really become to internalize that message that's best captured in the slogan, housing policy is climate policy for us.
And I guess I'll go last. It's nice to be here. My name's Jana Goretz O'Brien. I use she, her pronouns, and I'm a pediatrician out here in Minneapolis, but I'm here today representing the American Academy of Pediatrics. We are an organization of 67,000 pediatricians committed to the optimal physical, mental, and social health and well-being of all infants, children, adolescents, and young adults. And I think it's very clear to most of the people on this call that housing is health and has tremendous impact on the children, youth, and families that we serve. We know that health begins where we live, learn, work, and play, and the AAP knows this as well. And I think if you ask any pediatrician, we are seeing this play out now more than ever, as I think we are across sectors. So I'm so glad we're here together kind of having this conversation. So the AAP's advocacy work is driven by our peer-reviewed policy statement. So just kind of giving you a sense of how we roll, essentially, and how we make policy happen. So our work together is driven by the policy statements we put forth, and those go out to pediatricians across the country, and the work that we do individually with patients and also in our communities and as a national organization. In 2013, the AAP stepped up with a policy statement about providing care for children and adolescents facing homelessness and housing insecurity, and really outlined the effects that homelessness and housing insecurity have on children's health and potential. And it made several recommendations. And one key one that really has been a driving force in this work for our organization was that pediatricians and the AAP could advocate for the needs of homeless children and families by supporting local, state, and federal policies that lead to increased availability of low-income, transitional, and permanent housing. So that has been one of our policy statements, and that's been since 2013. So I feel like we were a little late to this game, but we are here and we're at the table, and I think we all know that housing is health. I think the other piece here is that the AAP is committed to eliminating health inequities and disparities, and we know that opportunity, including opportunities for health, start at home, as this is so aptly named. So this includes children and adolescent and healthcare professionals addressing social and behavioral drivers of health, including housing, when we're in our individual interactions, but it also includes advocating and identifying eliminating racist policies and inequities that show up and contribute to racial disparities. So housing is one place where we all know that racism shows up, and it shows up again and again here, and it has significant implications for the health and well-being of children. So I think those are two key policy statements in our organization that drive this work forward. In terms of what we've done so far, we've become a member of this coalition, and we are super excited to be here and be a part of it. When the pandemic hit, we were also glad to see the eviction moratorium put into place. We advocated for extending that initial moratorium last summer. We're excited that the CDC issued a subsequent eviction moratorium. We supported that action in several court cases also. We filed some amicus briefs here as well. And really, we are encouraging every single one of our members to recognize that housing is health, and especially during this pandemic. So we're here at the table, we're ready to do cross-sector work and kind of impact housing and health together.
Yeah, thank you all. I think that, again, kind of echoing your messages, if we're talking about education, our climate, our health, I think you guys just made a really clear statement about how your organizations are really thinking about these things. And Jana, I know you said that you're being late to the game, but Khalil, he shakes his head like, no, you're not. And part of this building this multi-sector coalition is just getting that work forward, moving that work forward. So thank you all for sharing about that. And we'll jump now into the individual questions to dig deeper into these connections. And Makita, you are the first one for your individual question. So my question to you is that research shows that children, they do better in school when they live in safe, decent, affordable housing. And there's a lot of talk, this national conversation for the past 20 years about education reform, but often that lacks the focus on the connection between housing policy and education policy. And at the NEA, you guys have joined the campaign because you understand this inextricable link between stable housing and high educational achievement. So how do you think about these connections, and how do you think that we get more education groups involved in housing advocacy?
Well, I mean, I think, a lot of education groups, most education groups, if not all, are very aware of the impact of housing on education and the impact of the generational, historical, systemic impacts of systemic racism, and how it shows up with regards to where we live, where we learn, etc. So I can't really speak for all education groups, but I don't think that there's any education group that doesn't acknowledge that's been an ongoing issue with regards to especially public education in this country. I will point out, in terms of the National Education Association, we are a union. Really, education policy is housing policy, and housing policy and education policy are also workers' rights issues. So from our standpoint, we see that connection. I think, in terms of when you say getting education groups involved in housing advocacy, I think one of the things that helps, and to Jana's point, having these conversations around a multi-sector approach is really important. I think reframing how we think about these different policies and the impact on communities is really important. It's not a either or, it's a both and I think this previous year has showed us that if we had any doubts before. So having conversations, just bringing more education groups to the table, inviting more education groups to have these conversations. I really, I think that's the first step. One of the advantages I'll say as far as National Education Association, like I said, we, over the last 5 years in particular, we have made addressing racial justice in education a priority. We've made addressing educational equity and racial disparities and the impact that it has on our students, the school to prison pipeline, et cetera, as a priority in addition to Black Lives Mattering as a priority in schools. So one of the advantages I think my department has, and I'll reference my director, Harry Lawson, who's Director of Human and Civil Rights at NEA, is that we have a pretty diverse staff that has different backgrounds. To your point, we have folks that are not just subject matter experts on education policy, but also have a background like Harry Lawson, our director, in housing. I have experience in housing policy as well as public health. So I think that's also helped having these conversations in these, education spaces and providing a broader lens to these conversations. So, just framing it around equity also, has helped us to have these conversations that brings in conversations around health, about housing, about environmental justice, and all of the impact that it has on our educator members as well as students.
Thank you, Makita, and uplifting something that you said there too, which is a way that we frame a lot of the conversations that we have at Opportunity Starts at Home about, like, education advocates are housing advocates, health advocates are housing advocates. It's like they're we are the same advocates. We're advocating for a lot of issues that kind of impact and have spillover impacts. And then you also touched on equity, which we do have a question later on that will kind of expand that more, talk a bit about that more, but how racial equity plays a part in these spillover impacts between housing and education, and how does all of that have a link to each other. So thank you so much for your response with that. And I'll move on to Khalil. Khalil, you recently stated in an article that housing has a critical role to play in the fight against climate change and must be seen as a front and center to that effort. And so why must housing be a part of any plan to address climate change?
Right. Yeah, I think I covered it a little bit in my intro, but just to go back, I think that we need to look at it in two ways. One, there is the direct impact that our housing and our building sector, much more widely, but really our residential sector has on our nation's carbon emissions. Again, we spend the majority of our time, if we're fortunate, in our homes, and that's where we consume the most energy. And so, the way that our homes are constructed, where they're constructed, all impact, the way that we consume energy, both within the home, but also in the additional footprint of transportation. And so, just as we think about, housing and transportation combined as being a part of an affordability metric, the other piece that we're going to have to add to that now is also energy. Is also a key factor in that. And so the direct impact that our energy consumption in the home has on climate, but then also as a nation, as we're trying to respond to the challenge of climate change, housing is going to be a key factor in making it possible for individuals, for families, for communities to be able to meet that challenge, to be able to make that transition. If we are shutting down coal-fired power plants in one community and that family needs to relocate to another community to find a well-paying job, again, energy policy is not going to help them move. The Department of Energy is not going to help them move. That's going to come through our engagement and ensuring that we have resources and supports available for people through HUD, through other housing initiatives to make that possible for them to be able to do that. And so the second piece of that is what I like to call the enabling function that housing provides. It provides that stability for people to be able to engage in this conversation, to be able to be able to engage in this green transition. And so it's just a critical element.
Yeah, absolutely. And to that point of moving, right, and getting people more into the conversation, make sure they're more involved. It's a broader view. Again, I think some people could get tunnel vision when it comes to climate and the things that we talk about, but also a big piece there is mobility and people having access to these conversations in green space. So thank you for that. Jenna, the link between housing and health is clearer than ever, in the light of the COVID-19 pandemic. During the pandemic, as leaders recommended that the public stay home to avoid community spread, many people experiencing housing instability and homelessness were at especially high risk. So what have we learned from COVID-19 about the connections between health and housing, and how can health advocates help inform housing solutions?
Yeah, I'm so glad this question is in here because I think the COVID-19 pandemic really just revealed some major challenges in our systems and significant inequities in our system. It just unveiled them. I think we've seen this across sectors too. So I think I'm seeing some nods. So yes, I think we're seeing this across sectors. We really kind of just pulled the sheet back and we saw, oh my gosh, we're in trouble. We knew even long before the pandemic that there are significant health risks associated with the experience of homelessness and specifically the experience of marginalization and systems involvement that comes with it and all of the health risks associated with the experience of homelessness and of housing instability too. So we knew that long before the pandemic. And I think we saw that, those of us who work in housing have seen that. I work in shelter with young people experiencing homelessness. We saw that long before the COVID-19 pandemic. But then we throw this pandemic into the mix and it just highlighted the link, right? I mean, we saw that young people and children and families were at higher risk of entry into homelessness, right? Those who were living right on the edge of that housing instability, my patients who I was seeing who were saying, I'm making decisions between my next rent check and my food on the table and my healthcare bills. Those folks, when the financial strain of the pandemic put them over the edge and they're at higher risk of entering homelessness in the first place. We also know that people who are experiencing homelessness or who are unstably housed also might have a higher likelihood of untreated chronic medical conditions, putting them at higher risk for more complicated COVID-19 disease. So it heightened and just further compounded disparities and inequities that we were seeing to begin with related to housing. We also see challenges, especially with the young people that I work with, where those resources that had been available at school, in their communities, in their neighborhoods that were available were cut right off when this pandemic hit too. They were isolated. And then finally, this messaging around public health campaigns, stay at home, shelter in place, it just rubs salt in the wound of this. I mean, it really is just asking people to adhere to guidelines to stay safe that are impossible for many of the young people and families that I work with. So I think we can do better. I think the second part of your question related, what can we do better? And we just led a study with adolescent health leaders looking at health leaders across the US and Canada saying, well, what are you doing in your communities? We're still figuring out what the impact is going to be, but what can we do from a policy perspective? And a big part of that was housing, young people. And I think it was one of the major themes that emerged in our analysis. And I think what we heard loud and clear was, look, providing single occupancy housing for folks is key, and making sure we stabilize families and young people that are at risk of becoming homeless, it was essential. So we need a really strong housing system to start to prevent anything like this from ever happening again. And then we also need to be prepared that in the setting of emergencies, we are ready to have housing available for folks, whether it's not only for folks that are who have COVID-19 and who need isolation and quarantine, but to prevent the spread by providing housing directly. And quite frankly, we should be doing that anyway, even outside of the pandemic. But in this moment, for sure, we need housing, and we need it fast, honestly. I'll pause there. There's a lot we can go on.
Yeah, that's great. Just really pointing out that housing is the solution, right? And also pointing out there just when experiencing the crisis, which is something that Nan also talked about in the beginning, which is one of our third policy buckets, is just emergency assistance. So in this time of like crisis, there's all these things piling up and it's happening quicker than ever in a very short period of time. And that ends up being a spiral for folks, which then puts them in a really, really tough situation, a tough thing to navigate for them too, and having to do that in a pandemic has been especially hard. So thank you so much for that. And so I do want to plug in here that we do have like Q&A in the chat box. So if you do have a question, please make sure that you place it in the chat box and we'll try to get to it at the end of the Q&A session for those of you who are with us today. And we'll move on to the third question, which is for everyone. And a lot of you touched on this topic already, so just wanted to give it a space to really talk about it. Because of decades of structural racism, we see tremendous racial disparities across our country. In housing, racial inequities manifest in terms of who struggles to afford the rent, who gets evicted, who experiences homelessness, who lives in a neighborhood of concentrated poverty, and who struggles the most with wealth building. And these racial inequities in housing, they have a spillover impact to many other sectors, as a lot of you guys touched on, including each of the sectors that you all represent. So can you speak to the racial inequities that in housing and how those racial inequities impact the field of work, your field of work? Let's see, like Khalil, you jump in first. Yeah.
Sure, I'll go first. Yeah, there are a number of cases. And so, first and foremost, we see huge disparities, both by race, but also by income, distinctions between, renter and homeowner. All of that is mediated by racialized politics in housing. But we see huge disparities in energy cost burdens. Black and Latino households, really across the board in almost every geography, have, the highest energy burdens, meaning that they spend a larger proportion of their income on household energy needs than others. They are most at risk of seeing their energy utilities cut due to arrears, which is particularly important. Now during this pandemic, we fought with other partners, to make sure that there were moratoriums not only on evictions, but also moratoriums on utility shutoffs. Because if people weren't able to keep cool in summer or to keep warm in winter, or to be able to keep their water running, because in many places, water shutoffs, which is another utility issue that we're very concerned about, was a way that landlords were able to subvert, evictions moratoriums, because they could be evicted if they didn't have water going into the home. And so rising water costs were a way that landlords were getting around eviction moratoriums in some spaces. And so, we see disparities there. We see huge disparities in the location of homes, who's in harm's way. We're talking about climate-related weather events and extreme weather, whether it be flooding, those types of things. We see the legacy of redlining in the amount of tree cover that various neighborhoods have, which increases the local heat index for those communities because they lack the tree cover. So we see 1-for-1 a relationship between legacies of redlining and the lack of tree cover, which increases the incidence of heat-related illnesses and death, particularly for elderly residents at home, which also again increases energy costs, particularly in the summers.
I'm happy to pipe in next on this one because I think we have some similar themes here with respect to the impact of housing on health, and the disparities that have emerged. I think we also in health are still seeing of course we are because they're still going on, the legacy of redlining as well. So I think that housing in particular in neighborhoods and where young people and children and families are living without a doubt translate directly to the disparities we see in health. Even the quality and safety of housing has direct impacts on the disparities that we see in health. We know that young people of color and children and families of color are much more likely to live in homes that are unsafe and to be displaced from those homes and to be evicted. So I think a big part of what we have to do in order to mitigate these disparities and start to rectify our long history, unfortunately, and legacy of racism in this country is housing people and providing them with not only housing, but safe, affordable housing that is good for health. And a lot of what I think about when I think about what a healthy neighborhood looks like and what healthy housing looks like relates to a lot of what Khalil is bringing up, which is having green space, having safe neighborhoods, having areas where young children can learn to grow and play. And we're not seeing that right now. And we're not seeing that right now in many of our communities of colors and many of our communities that have been historically marginalized. So I think when we look at the stark disparities that we see in healthcare, going from the time of infant and child mortality and perinatal mortality for women of color and specifically Black women in this country, all the way up to the disparities that we see in adolescence and young adulthood among young people experiencing homelessness, we see that across the board. And there's no doubt in my mind that a lot of that relates to a history of racism with housing and the communities that we live in and the neighborhoods we live in. I just can't say it enough. Housing is health. I also think when we think about policies then, and we think about how do we do this work, I think we need to be prioritizing policies that are intentionally anti-racist and that we think with respect to housing. And I think that will directly have an impact and translate to improved health disparities and reduced inequities when it comes to young people and the children and families that we aim to serve as pediatricians. So yes, housing is health. I think shelter saves lives, and we know that, and having safe neighborhoods save lives as well. And for the children and families we work with, we need to be thinking about housing as a key social driver of health and a key social driver of health disparities and inequities.
Yeah, I guess I can just continue the theme of the impact of systemic racism with regards to housing around the, related to redlining, inequitable distribution of resources in neighborhoods, etc. I think for National Education Association, this was a particularly hard year for our members as well as our students, as with everyone. And we know that these things were, brought to the forefront, exacerbated. Unfortunately, the inequity, continued and it unfortunately increased. With regards to really, as simple as which students, was able to get a quality or as close to a quality education at home and those that weren't. So, we have a lot of students that were already left behind due to the inequities before COVID. And, that's just worsened. So there's some huge significant gaps. Another thing that we have conversations about when we talk about racial justice is the trauma that BIPOC communities experience, particularly students, and to be quite honest, our members as educators of color who are dealing with not only with the racial inequity of being as in the educational profession, but being in these communities and dealing with the disparate impact of COVID had in their own families. So this has all been compounded. So there's a lot of work to do. And, I think the current administration has made some efforts in terms of, a step in the right direction. But, it's going to take, quite a lift to address some of the inequities, as well as try to address the continued ongoing inequity. So, again, it's both and.
Yeah, thank you all. And that last point, touching on that is that touching on the past and also what's happening in the present and how these things have been compounded through opportunity starts at home. We talk about housing has housing is like the center to what you have access to, what education you could have access to, what health you have access to, what nutritious foods you have access to, what transportation you have access to. And when you layer that on top with like an intentional racial racial disparity, treating people of color in a way that's manufactured to create those disparities within those organizations and communities, I feel like the line in which those things are connected become much more clear if they're not already clear for a lot of folks. The ways that racial inequity is within everything that we're talking about when we're talking about the solutions and the problems that we see in a lot of communities, especially in the ways that they show up for people of color. And so thank you all for responding to that question. And we're going to move on into another individual section where you all have an individual question. And I'll go with you, Makita, first. So you also mentioned this, that you have a background that's diverse. You have a background in education, in housing, in health, and racial equity, and you've done them on the local, state, and federal level. And often we hear many times that the housing solutions that we advocate for should be handled at the state and local level. Given your multi-sector and multi-level background with these issues, why is federal government involvement critical to advancing these solutions?
That's a hefty one, and I'll invite all of our other panelists to chime in. But we know the state and local governments can't do everything alone. Resource-wise, program and services wise, generally speaking, federal policy. There's a couple of important levers that it provides and roles that it serves, obviously, in terms of funding. But then, there is a really important role that federal policy should play, often does play, can do a better job at playing. And that is, around fairness and ensuring equity, and strengthening protections, whether it's rental assistance or, around educational equity. So, federal policy is very important. I think, rather than thinking of local, state, and federal policy, really successful solutions should be existing on all of the different levels, right? That's the ideal scenario. So, I guess, in terms of addressing disparities, the role of federal policy plays an important role. But like I said, it doesn't always do the best job, but it's necessary. It's necessary in addition to the state and the local policy around, in my case, education policy or even housing policy. And I'm welcome Khalil or Jana to chime in as well. I do a good enough job.
Sure does look like it. So we'll move on. We'll move on to Khalil. Khalil, the Natural Resources Defense Council is one of the newest members of the campaign steering committee. And our question for you is, has engagement with the campaign helped to strengthen NRDC's housing advocacy? And if so, how?
Yeah, absolutely. Again, this is for us, and I feel like the environmental community, deserves, a little bit of congratulations or whatever have you. We have been attempting to be much more self-reflective in the way that we approached a lot of these questions, the way that we communicate about them. You've heard the saying, oh, it's not just about polar bears, although the polar bear is our logo, and we do care about those too. But our environment, is about more than that. And so this work, with housing, has really been the leverage point, I think, for opening up a much broader conversation in how we gauge, outside of the traditional, realm of environmental policy or energy policy, but into, spaces that we traditionally, have not gone into. I think it's also, I think, you see it when you hear the government or you hear the Biden administration talk about wanting a whole government approach to the question of climate change. That means more than just, finding the carbon emissions, in each department. That means figuring out what each department, what each federal agency, can do to help facilitate this transition. And the answer to that is going to be unique, whether we're talking about DHS, whether we're talking about HUD, whether we're talking about USDA, EPA, et cetera. But each agency has a role to play in helping us to manage this transition. And again, I just can't stress enough, housing is obviously the central element, within people's lives. And I should also mention this administration has issued, a plan to cut carbon emissions from the residential sector by half by 2035. That is a little less than 15 years away. But that implies a great deal of investment coming into the housing sector, to retrofit those homes, to replace gas lines with electric appliances, which also implies a lot of work. But if we aren't careful with the way that those investments are funneled into the residential sector, we could increase cost on those families who are most vulnerable. And so again, a conversation between our energy and our climate policy and housing policy is key in making this whole government approach work and work in a way that benefits those families who need it most.
Yeah, communication there, right? Having these communications between people in these fields to even kind of map out what are those things that might have a negative impact on communities, what are those things that we need to address that also make sure that the solutions that we're pushing for are holistic to the individuals and the people that we're trying to serve. And so thank you, Khalil, for that. I'm going to move on to Jana again for your last individual question. Your background as a pediatrician and your research focus on the healthcare of the youth experiencing homelessness provides direct access and information to the experiences of our nation's youth. So can you speak to what you have learned in your work and how these connections show up in the daily lives of people that you engage with?
Yeah, I'm so glad we're talking about this question. I think youth are often left out of the conversation when we talk about housing. So I'm glad we're having this conversation. I'm also glad that education is at the table too, because I think they know it well. And I see Makina nodding. Wow, it's a big question. So with respect to how we see young people and youth experiencing homelessness and how that shows up with respect to their health, I mean, much of our work has shown over and over again that housing, again, is the foundation of health. And I've said that over and over, so I'm not going to hammer that home. I think the thing that's exciting about our work, and I think what it highlights and models for our work at the housing level, at community, state, and federal levels, as Makina was advocating, including all three of those levels, I think is that we really need to be doing this work with communities, in partnership with communities, in partnership with young people who are experiencing homelessness, and across sectors. So much of the work that I do in terms of our research is community-based participatory research. And what that means is that we're not an academic center coming in and doing research on a community. We are hopefully, and what we strive to be, is an organization coming in to work directly hand in hand with community to figure out solutions and strategies that work in partnership with young people. And I think really what's been key to all of that is having multiple sectors at the table, kind of having these conversations with community and with partnerships. And I think a lot of that work is now translated into advocacy work that we're doing at the community level, the state level, and at the now hopefully at the federal level too, to kind of say, look, how can we walk hand in hand with people who are having these experiences and who are experiencing housing instability and homelessness? How do we make sure that they are included with those with the lived experiences are included at the table? I think there is abundant literature that shows that there is a tremendous impact of housing on health, and our work and our research corroborates that. But I think really what I've taken home as an individual, kind of learning and having the privilege to work in communities and with young people, is that when we have them at the table, they really have tremendous knowledge and expertise on these issues, and they need to be included in the policies that we're working on too. In particular with youth, I mentioned that they're left out of the conversation. They also tend to be dismissed and undervalued. The young people and families that I work with who are experiencing homelessness and homelessness and housing instability are oftentimes the most resilient and savvy young people and families that I work with. And I think that as communities and as policy folks who are trying to influence policy, we need to really highlight the strengths of these communities and of the people with lived experiences there. And we need to bring them to the table, not only to these conversations, but to conversations we're having with policymakers about this. So I think that's a big kind of take home point from the work that we do. There was a question in the chat that I think relates to this that I think is worth mentioning too. So some of the work that we've done in partnership with community has been about building in supportive housing and healthcare options within other sectors. So I also work in school-based health, and I also work in shelter-based healthcare. So I think those are really good examples of times when we cross sectors in our work directly with youth and families, where we are across sectors working in schools with children, youth, and families experiencing homelessness, or in shelter with children, youth, and families experiencing homelessness. And I think that that work needs to be prioritized and thinking about how can we at the community level be working together to meet people where they are at. As a healthcare provider, I think there's a mentality that like, oh, they can come to us when they need us. But I really think we need to be going to them and being embedded with community and walking alongside them as we, people experiencing homelessness as we do this work. So I cannot emphasize that enough. And that was a great question in the chat related to that. And yes, in the daily lives, I think, and how do they show up in the daily lives of people we engage with? I think they're grateful to be a part of the conversation. And quite frankly, I think they deserve to be a part of the conversation. So I hope that we can continue to include folks with lived experiences with this and be in contact with our communities at every step.
Thank you. And I think this is a great way to open it up to Q&A in the last few minutes that we have here of the webinar. So I don't know if anyone else has any feedback on that question, but I'll read it out to you all. The question goes, have any of the panelists seen supportive housing investments by anchor institutions in the community, healthcare systems, hospitals, as a way to reduce preventable ER visits, hospitalizations, and can these investments be promoted? So just that community angle piece, if anyone else wants to reply. This one was kind of based more on health, but I don't know if anyone else has any feedback on that as well.
I guess I could say, one of the things that I failed to mention with regards to NEA and other education groups is one thing that I think COVID provided us was to really think about public education differently and the classroom differently, and how we engage with our students differently. One of the things that we're a huge supporter of are community schools. The Biden's plan does fund, I think, about $40 million toward community schools, but we do see them in the future. There are some in local districts now, but we do see them as a best practice model in terms of an improved education, public education system for students. And really what community schools are all about is just exactly what it is, having the schools have connections with community partners, have the school be serving as a hub in communities, ensuring that students and families get access to wraparound services. So, healthcare, health coverage, et cetera, being one of those. It's served as a great model in some local school districts, and I think it does have potential to help address some of these issues. Being a union, and like I said, I feel as though housing policy is also a workers' rights policy. I'm a strong supporter of bargaining, our members bargaining, around housing issues. They're being impacted by housing issues that's also impacting education and impacting their jobs and their students. And so we're seeing more of that when our members go to the negotiating table. There have been some examples of where members are taking upon themselves to actually include housing issues when they go to bargain. So those are two things that immediately come to mind.
I'd like to build on that community schools thing. Can I add to that? Is that all right? I want to build on the community schools piece. So somebody who works in both school-based health centers, has worked in school-based health centers as part of a community school, which was one part of that, providing healthcare directly on site. That was actually how I started to, as a young pediatrician, started to learn and see the impact of housing on health. So again, I think it's a really great model of cross-sector work at the community level that can be funded, just to answer the hard question that Makita got, to how that can be funded and supported at the national level as a national priority. I think school-based health centers can be a big part of that. It's not necessary that every community school has a school-based health center, but I do think many of them do, and those models work really well, and there's strong evidence that it helps with addressing both the social drivers of health and also reducing health disparities and improving health outcome. It is a key equity intervention to have healthcare, schools, housing, and community resources linked together. So I think housing is health, and also connecting cross-sector communication or cross-sector work to connect folks where they are in community is just essential. I think community schools is a really beautiful model for that.
Yeah, thank you. And well, we just have a minute left actually, so let's wrap it up. But thank you all for joining us today. And we had a couple of questions about recording. So recording will be available for those of you who would like to share it with your networks. Some contact information was also asked, so we can share it. We will share it with you all as well. And there are some other questions in here that we'll ask our panelists to get back to you. We'll just collect all that information for you all. But otherwise, I would like to thank all of the panelists today for joining us to speak about multi-sector partnerships. And as we mentioned in the beginning, this is part of a 3-part series. So please stay tuned as we put more information out on the next few webinars that we will host. And I want to thank you all for joining us today. Thank you, everyone.